Hey guys, we are going to do the notes for today and finish the ones from yesterday that did not work or that I forgot. Sorry, they worked. It was my fault. I did not work. And let me find my sheet here. We are going to add in the three types of circuits or circulations that are found in the cardiac pathway. And I told y'all to get three colors yesterday, and then I forgot to use the third color. So anyway, let's talk about what I forgot to do. The right side of the heart is responsible for pumping blood to the lungs to pick up oxygen. And that pathway is called the pulmonary circuit or pulmonary circulation. We talked about that when we drew our very basic heart on day one. I just wanted to label it on this sheet as well. The left side of the heart is responsible for delivering that oxygenated blood through the aorta into the systems of the body, whether that's superior to the heart or inferior to the heart. And therefore, that side or portion of the circulation can be called the systemic circuit or systemic circulation. And then finally, this middle section that we couldn't really label on our heart the first day is responsible for taking oxygenated blood from the aorta and then delivering it to the myocardium or the muscle of the heart so that that muscle can continue to contract and the heart can continue to beat. And therefore, that portion of the circulation is called the coronary circuit. So this area is just describing this section. The pulmonary circuit is just from the right side of the heart, and then the coronary circulation or coronary circuit is going from the aorta to the heart muscle and then back to the heart itself by way of the coronary sinus and right atrium. All right, and that finishes this. So that was my fault. I guess I was just tired and ready to get through the notes. You got a packet in the mail, hopefully. I got some good feedback from y'all that most of y'all had received your present in the mail. And I did it as nervous system first because I thought that's what we were going to be doing. And I thought that we would do that first, but I think the heart's a better choice. So if you sift through your packet, we're going to start on this sheet that says structures of the heart. And then we will do the back sheet that says external structures of the heart, and then just the front side of this sheet. So we're only going to label anterior and posterior section of the heart today. And then tomorrow we will do cross section of the heart where we look at what the inside looks like and specifically where those valves that we learned about yesterday are found. All right, so let me switch over and make sure that my Zoom thing is working correctly, hopefully. All right, this is my second time doing this video, so maybe the second time it'll work. All righty, so let's start with this picture of the heart, which is the first one in your heart packet. Let me cover these up real quick. I'll be right back. Okay, so we're going to start with the heart as it appears in your body. This is exactly what it would look like, minus the red and blue coloration. It would all be kind of a reddish pink color, peachy color. And so we're going to start with the anterior view, meaning what does the heart look like from the front of the body? And we always have to keep patient's perspective in mind so that we get our rights and our lefts correct. One way to double check yourself is to look at the left side of the heart and look for the point is what I think about. Like a Valentine's heart has a good distinct point to it. And the point of our heart is going to point towards the left, which is why we put our hand on our left chest whenever we say the Pledge of Allegiance. That point is called the apex of the heart. And that apex will push over into the left chest cavity just a bit, which makes our left lung a little bit smaller than our right lung. And that point again is just called the apex of the heart. I like to kind of follow the pathway of circulation that we did yesterday and keep everything kind of in the same order. So we're going to start with the right atrium. It's a good starting point. It's kind of how my brain works. So that's how I look at the heart. I always start with the right atrium and work my way around. The blood vessels that feed into that right atrium are the superior vena cava, inferior vena cava, and coronary sinus. The superior vena cava is this blue vessel that you see here, and it's going to bring deoxygenated blood into the right atrium from anything above the heart. So our brain is draining that deoxygenated blood through our head, down our neck, and into that superior vena cava. Anything above the heart is going to drain that blood back to the superior vena cava. Same thing would be true for the inferior vena cava, but it's not always visible from the front side of the heart, depending on what diagram you're looking at. If it is, sometimes it'll be about right here, and it will look like it's coming out of the ventricle, or that the ventricle would empty blood this direction, but that's really wrong. Okay, so that inferior vena cava is actually going to bring blood up the back side of the heart and then sneak it into the right atrium with the superior vena cava. From that right atrium, we're going to go into the right ventricle. Okay, the right ventricle is then going to contract and send blood out this pulmonary vessel. Okay, we're going to the lungs, therefore you would expect it to have some kind of pulmonary word in its name, and we're going to stop first at the pulmonary trunk. Okay, the pulmonary trunk will then split and will become the left and right pulmonary arteries, and it will carry blood to our right and left lungs to pick up oxygen. Then from there, we got to get that oxygenated blood back to the heart. It's got to finish its job. So blood's going to enter into the left atrium like this, okay, by the blood vessels that are carrying blood towards the heart, which would be a vein. Remember, veins go towards the heart. We have a right and left lung, therefore we have a right and left pulmonary vein. Okay, this one looks like it's coming from the right side of the heart and it's going to go right into the right atrium. Okay, but it's not. It's going to meet up on the back with this left pulmonary vein at the left atrium. Okay, from that left atrium, I can click correctly, we will go into the left ventricle, and that left ventricle is our most powerful ventricle. It is going to contract. Blood's going to be pushed in this direction through the left ventricle and then up into the biggest blood vessel in our body called the aorta. It's kind of weird because it looks like the blood coming from the left would go into this vessel, into the pulmonary trunk, but it doesn't. The pulmonary trunk crosses over that aorta, so it's almost backwards from the way you're looking at it. But anyway, the left ventricle is going to push oxygenated blood up into this aorta. First thing the aorta is going to do is start to carry that blood up, and then it's going to arch. And then if it was labeled on the diagram, that aorta would scoot down the back of the heart and would become the descending aorta. Okay, so that oxygenated blood is going to go up these three branches to supply my neck and head with oxygenated blood, and then come down the back side of the heart and supply my belly or anything inferior to the heart with oxygenated blood. Because the blood is moving in an upwards direction in this part of the aorta, it is called your ascending aorta. And then it arches, so it's called the aortic arch. Okay, aortic just being an adjective there. From that aortic arch, again, we would come down and have our descending aorta. Now, not only is that aorta responsible for supplying my head and neck and my body with oxygenated blood, but remember, we've got the coronary circulation too. We've got that middle section on the pathway of circulation that we did yesterday, and that is going to supply the myocardium with oxygenated blood, what the muscle that you see, this kind of pinkish color that you see on this picture, the actual heart itself. And that is done by coronary arteries. When the coronary arteries deliver their oxygenated blood to the muscle uses it, and then the deoxygenated blood is brought back to the right atrium by cardiac veins. And remember, veins are going towards the heart. We're just going back towards ourselves there, okay, because the cardiac veins are stuck to the surface of the myocardium. In this picture, they're labeled together. So we will have right coronary arteries and right cardiac veins, and left coronary arteries and left cardiac veins. And why they're called coronary arteries and cardiac veins and not both cardiac or both coronary, I don't know. And nobody I've ever asked has been able to answer my question. So I think it just kind of is what it is in that situation. So these coronary arteries are going to deliver oxygen to the myocardium, and then the cardiac veins are going to take it back to this right atrium. And those cardiac veins are tiny, and they're going to join in to a bigger vein called the great cardiac vein. And that great cardiac vein is going to cut around to the back side of the heart, and we'll see it in a second. It will join into the coronary sinus, which is this like collecting pool of deoxygenated blood on the backside of the heart that will go into this right atrium with our other blood vessels carrying deoxygenated blood. So let's flip to the back. The back of the heart is tricky to me. I always have to think when I'm looking at the back of the heart, because number one, it's the back, and I always get confused looking at the posterior view, but I have to just think really hard whenever I do this. All right, so let me undo that. That didn't look good. Okay, the back side of the heart is going to be the same as our perspective. It is not, it's still patient's perspective in an anatomical position, but because we're looking at the back of the heart, we're looking at it with the same rights and lefts as ours. So be careful with that. Always double check yourself with the apex, because the apex of the heart is always going to point towards the left. So this will be the left side of the heart, and this will be the right side of the heart. And now you can see that inferior vena cava. Okay, superior vena cava is on the superior portion of the right atrium, and then that inferior vena cava would continue down like so. Okay, and it is carrying deoxygenated blood inferior to the heart back up towards the heart. It's a vein. It's carrying blood towards the heart. We're getting all that deoxygenated blood back into the right atrium. Okay, so it's much bigger than just this hole right here. And in fact, it is going to travel with the aorta. So I'll draw that one in just a second. Let me not get ahead of myself. So superior vena cava, inferior vena cava are going to deliver deoxygenated blood into the right atrium. And then from there, we go to the right ventricle. From the right ventricle, we scoot through that pulmonary trunk and then to the pulmonary arteries. So you can see the pulmonary arteries from the posterior side of the heart. They would be carrying oxygenated blood to my right lung and to my left lung. Okay, remember, arteries away. These are the exceptions to the rules. Most of the time, 9 times out of 10, an artery is carrying oxygenated blood, but not this one. Okay, not the pulmonary artery, because the pulmonary artery is going to the lung to get the oxygen. The other exception to the rule is the pulmonary veins, because typically veins carry deoxygenated blood, but not these, because these are coming from the lung towards the heart with that oxygenated blood. So the pulmonaries are the only exceptions in the body that flip-flop that deoxygenated and oxygenated blood. Okay, from the right ventricle, again, we go pulmonary trunk, pulmonary arteries to the lungs, bring it back to the heart by the pulmonary veins, and deliver that oxygenated blood into the left atrium. Okay, left atrium then goes to the left ventricle. From the left ventricle, we're going to squeeze into the aorta. You can see the posterior side of the aortic arch right here, and then the descending aorta is going to go down the back side of the heart. Okay, now that aorta is an artery. It is carrying blood away from the heart. It is carrying oxygenated blood away from the heart. The inferior vena cava runs right beside it. So they are buddies, and they will go down your belly. One is carrying blood up, one's carrying blood down. Okay, much like a highway. They're running opposite directions. And again, one's just carrying that oxygenated blood to the inferior portions of your body, and then the other one's carrying that deoxygenated blood back to the heart. So they run side by side. That deoxygenated blood has also got to, let me say it this way. The myocardium has used its oxygen, and it needs to get that deoxygenated blood back to the heart, back to itself. And that is done by the great cardiac vein. All of these little bitty blue cardiac veins that you see on the surface of the myocardium are going to just join in with a bigger vein. And that bigger vein is called a great cardiac vein, which will then all collect together into this collecting pool called the coronary sinus. And that coronary sinus is a groove or a space where that blood will feed into the right atrium with the superior and inferior vena cava. Okay, same thing that we just looked at. All right, so let's go to the more hand-drawn picture of the heart, and then we will be done for today. All right, we've already done that. Okay, so this is your second sheet in your packet of, probably the third sheet in your packet of heart stuff. So let's look at this structure. You can't change the heart. Okay? I can't change the fact that the three vessels that enter the right atrium are superior and inferior vena cava and coronary sinus. Okay? I can't change the fact that, you know, there's 26 and we get off on whatever exit to go to school. Okay? That's just kind of how it is. And that's kind of how the heart is. I can make it look as different as I want. But if you go to that pathway and you go to that simplistic view that we drew on day one, it will not deviate from that. If it does, your heart won't work. Okay, so your heart wasn't made correctly. Every time you go back to this, it is what it is, and it goes from here to here, which is probably why I like the heart, because there is no wishy-washiness to it. It is what it is. Okay, and this is the generalized structure. Now, physiology, we haven't got there yet, and that's confusing. But anatomically speaking, pretty simple organ. Okay, speaking of superior and inferior vena cava and right atrium, let's start with this. Three vessels that dump into the right atrium are superior vena cava, inferior vena cava, and the coronary sinus, which we can't see on this picture. Okay, so deoxygenated blood coming in from the top, deoxygenated blood coming in from the bottom. Okay, this is not a blood vessel that is sticking out of the bottom of the heart so that blood can go out and down. Okay, it's confusing. Okay, you want it to do that, just how your eyes work, but that's really not what's happening. Okay, so deoxygenated blood's coming up and squeaking into the backside of this right atrium. Okay, from the right atrium, we go into the right ventricle. And from that right ventricle, we're going to go into the pulmonary trunk. That pulmonary trunk is going to split to right and left pulmonary arteries. From those pulmonary arteries, we go to the lungs. Those lungs give us oxygen. We bring it back to the heart, to the left atrium. Okay, left atrium then goes through the mitral valve and into the left ventricle. From that left ventricle, we are going to go into the aorta. Now, the aorta is not labeled in all of its parts here. This would be the ascending aorta. Aortic arch is here, just labeled aorta. Then we also have the descending aorta on this picture. So the descending aorta is going to be carrying blood down. This aorta would have ascending, then the aortic arch. Then you can see it has its three branches coming off the top and going up to your head and neck. Okay. Now, also on this image are some of your coronary vessels and some of your coronary circulation. And it is really hard to distinguish between a cardiac vein and a coronary artery. And I will always give you one that has coloration to it that will help you see. But the great cardiac vein is going to scoot around. It is going to look like a circular, look like it's going towards the back of the heart. These on the surface here that come down like little snakes on the surface of the myocardium, it's out of our scope to be able to tell the difference just based on this image. So left coronary artery, left cardiac vein, and then we have a right cardiac vein and a right coronary artery as well on the right side to just supply the right side of the heart, the right myocardium, with oxygenated blood and getting that deoxygenated blood back to the coronary sinus and right atrium. Now, down here at the point, it is still pointing to the left, and that is going to be the apex of the heart. That doesn't change. And then the base of the heart is a new term on this diagram. It's just kind of this center section of the heart. You would want base to be bottom, but it's actually close to the pulmonary trunk on that kind of the in-between spot for the right and left atria. All right, so let's flip it over to the back and review that back structure, and then we'll be done. Okay, now the back image here, clean off some of this messiness from last year. The back view of the heart, remember, is going to be the same as our directions because the patient's perspective, you're looking at it from the posterior side. We have always look for the apex number 1 and then look for the aortic arch at the top. That's also a good landmark to look at the heart and see, oh, I kind of see that candy cane hook at the top of the heart. If you look at it from the front, the same thing is true. You've always got that candy cane hook on the top of the heart, which will be the aorta. The pulmonary trunk will not have that arch. So when looking at it, distinguish it between the arch or not arch. Okay, so that's one way. There's your aorta. Okay, the aorta is going to branch and carry the oxygenated blood to your entire body. And then on the front side of that, you're going to have your superior and inferior vena cavas emptying into your right atrium. Okay, so that's your superior vena cava coming down, and this is your inferior vena cava coming up into that right atrium. And your left atrium is kind of centrally located when you're looking at the posterior view of the heart. And the blood vessels that are carrying blood into that left atrium are your right and left pulmonary veins, whereas the blood vessels that are carrying blood out of your right ventricle are going to be your right and left pulmonary arteries. Okay? Remember, those pulmonary arteries are carrying deoxygenated blood away from the heart to the lungs. All of the deoxygenated blood is going to come from your myocardial blood vessels and then drain into this coronary sinus. And if this is my right atrium, that coronary sinus is just going to plop and dump blood into the right atrium with the inferior vena cava and the superior vena cava. All right, so that gets the anterior and posterior sections of the heart labeled. And make sure I didn't leave anything out. I don't think so. Okay, so we've done the front and the back. We will do the cross section the next day, tomorrow, because it's got a few more details to it that I don't want to overwhelm you with at one time. And I will put up some reviews for y'all to practice the imaging and practice the anatomical labeling for posterior and anterior views. And if y'all have questions, just give me a shout. Hope y'all have a great day.